Jim has filled out an extensive questionnaire asking about his symptoms, his ailments, his health history, his lifestyle, and many other questions. Listen attentively as Dr. Whitley leads Jim into understanding the common denominator of all of these symptoms. Just as an experienced guide will point out to you the stepping stones as you are crossing a river, so too Dr. Whitley is guiding Jim and his patients to see how balancing the oral system will be the catalyst to their healing. Pay special attention to the one question Dr. Whitley asks that will show the psychological state of his patient. He will ask the patient, if I had a pain pill in the back that I could offer you that would take away all your pain, what would you do? There are 3 answers to that question. If the patient says, no, thank you, I'm not interested, or the answer, maybe I would consider it. But if the patient says, yes, please let me have that, then Dr. Whitley knows that he has a desperate case on his hands. And Dr. Whitley will follow up, asking that patient if they have thought of death and dying. He will come right out and ask them if they have thought about suicide. You have to find the mental state of your patient. In one of these interviews, the next day, the woman brought in her suicide note. That is how powerful this interview can be. You must take it seriously. The other questions Dr. Whitley will ask is to help them to understand the difference between stress and adrenaline. Another purpose of this interview is to have the patient sit there for an hour, allowing the adrenaline to build up in their system. Because immediately after the interview, Dr. Whitley takes them into the treatment room, puts in the appliance, and as a balloon loses all of its air, so too the patient will release all of that built up adrenaline, truly taking a deep breath for the first time. It is amazing to watch. So take copious notes. Dr. Whitley is a thorough and assiduous teacher. Enjoy the video. It's an awesome opportunity.
So, Jim, we're going to do what they call the functional interview, which is no more than kind of connect the dots, if you will, as to what's causing the problem. And I'm just going to say right off the bat, it's not stress. If you ask people about stress, you're going to get about 100 different loosey-goosey psychobabble answers. But if you ask them about adrenaline, if they're smart, they'll give you the chemical formula, but they'll all tell you it makes your heart beat fast, it makes your muscles tight, your stomach feels crummy, you pant instead of taking nice, deep, diaphragmatic breaths. So everybody identifies with that. Stress is just a kind of an opinion about what may be causing the problem, but the actual chemical, to simplify it, is adrenaline. There's a bunch of other stuff in there, but if you just focus on, it's a chemical causing the heart to beat fast, or the muscles to be tight, the headaches, from muscle tension headaches. It's a lot easier to wrap your head around them. So before we get too far along the way, what are, say, 3 or 4 goals of treatment that you might have that when we're putting that appliance in, you're hoping and praying that those 4 things at least are satisfied? We call them goals of treatment. What would you pick?
Well, I know I need to get some dental work done first, and that's been a problem. And I'd like to be able to sleep at night without a sleep app machine. I'd like to be able to wake up fresh in the morning and feel energy all day. And is that enough?
Well, you get one more, because getting the dental work done is a prerequisite to getting this other done. You don't want to build a solution to your problem on, so to speak, rotten wood or teeth. You want that foundation to be done first, cleaned up, get rid of infection, inflammation, and that you're not going to have a lot of fillings and crowns or stuff done. And then all of a sudden the fit of your appliances change. So that's one. We're just going to leave that as we're going to do that anyway.
Okay.
But
one more? I've got one in mind.
Okay, fire.
I'd like to not feel fatigued, so I feel like exercising again.
Okay. And so that's three. If you have a fourth one, you can fire.
Those are the three main ones that I can think of at this time.
Okay, that's good. What makes me excited about this visit is I'm more excited about what you're not bringing up that happens than even these things.
Okay.
I see these all the time, so this is a piece of cake.
Okay.
But unique to each one of us are some things that happen that just like blow your mind.
Well, there is one more. I do, about a little over a year ago, I was diagnosed with atrial fibrillation.
Oh, okay.
And I honestly believe that's connected to my sleep pattern, because the only time I've ever experienced it is at night. And I just hope that can help me with that.
Well, if it doesn't, I'll be the most surprised person on the planet.
Really?
So take that as my promise to you is to work on all four of these, and a bunch of them you haven't even thought of. I'll be like a bear on honey. You know, it's just my goal in life, so that you don't feel that way, because I've been there. I had right-sided heart failure, I had a bunch of stuff. And
well, maybe it's been like a frog in a pan of water over the years. I'm just so used to things that I won't realize it until it's gone.
That's a very good analogy, because when it happens, the reason we're having this discussion in the beginning is so that you won't miss what's happening. You'll just take it for granted that maybe the weather changed, or you got on the right side of bed for a change, or but you will. We don't want you to take a diary. That's getting into your brain too much. But just realize that the only thing that's different tonight. Oh, happy birthday to you, because this is going to change everything. And
I promise that I will start becoming aware of what's changing, and I will attribute it to this. I don't believe in coincidence.
Right. So the deal is, you're looking and you're ready, and we're going to go over some things that are common to everyone, male, female, young and old. There are some gender differences, but not much. You probably won't have hot flashes, and your period may not change at all. But your prostate may. So just kind of keep in mind that what we're doing is an optimization of function. If half of what we saw gets out of the way, you're going to feel like somebody jacked your eyeballs up and put a new body around it.
I'm ready for that.
Okay. Well,
it is imperative that one of the items that you discuss as you get this patient prepared to receive the appliance is their goal of treatment. Have them establish 3 specific goals. We call them SMART goals, goals that are specific, measurable, attainable, relative, and timed, so that they want to be able to say this is a goal, and they can check to see if indeed that is achieved, as opposed to an ethereal goal that says I just want to be able to sleep better. Well, what does sleeping better mean? Sleeping better means that I sleep a full 8 hours and never wake up, something like that, something that is specific. So establishing the goals of treatment, we talked about that during the consultation, but especially in this video, this preparing the patient for that delivering of the appliance, it is imperative that you reestablish their goals to remind them.